Hi everyone, my name is Amanda Zimmerman, and today I will be training you guys on how to effectively begin to onboard a new client. So the purpose of this training is to give you guys those skills so that you guys are prepared to effectively onboard a new client. This will allow a seamless transition for all involved, to the staff, the client, the family, and it prevents delays in treatment authorization. So an example would be like the clinic receives 2 clients who will go to 2 different BCBAs. One BCBA followed all of the steps for onboarding a client effectively, while the other one skips multiple steps to complete the onboarding faster. The BCBA skipping the steps causes a delay in treatment authorization, and then it pushes back the client's start date compared to the BCBA who followed all of the steps and reviewed all the materials required to get that client started in a timely manner. So the learning objectives: by the end of this training, you guys will be able to identify the importance and purpose of the client onboarding process, gather the appropriate documents and information required during intake, collaborate with caregivers and colleagues during the onboarding process, sometimes during the initial intake assessments that we'll talk about later. You will collaborate with other people. You may have like an intern helping you out with that. So you will also effectively onboard a client with a smooth transition to prevent delays in treatment authorization, and then be able to identify what a SMART goal is. We're going to go over that, and we're going to practice that a little bit. So step 1 would be gather the referral and background information. You will want to gather the referral and the reason for the referral, including the diagnosis. You'll have the intake interview with the client or their caregivers. This is where you find out valuable information such as the medical history, the family structure, etc. Medical history is important because it lets you rule out any medical factors that can be contributing to the client's behavior. You'll gather information about the family structure, such as who lives in the home, family medical history, and their cultural background. It's really important to ask questions about the client's culture to build rapport, show openness to learning, and to know about cultural variables that you may need to incorporate into interventions later on down the road. And then you will review and identify background information, including previous interventions, such as if they received early intervention services like OT, speech, etc. And later we will discuss the handout that I provided you guys to gather these materials and place the information in a template that's easy to follow. Please make sure that you have grabbed all of the handouts at the check-in by the front entrance so you're able to follow along during the training. Step 2 is the intake assessment. This is a vital step to the onboarding process. This is where we will gather our baseline data and determine the areas of need. The BCBA, the person assessing the client, will choose the best assessment tool for them based off of specific areas of need. For example, a BCBA may choose to run an intake assessment during using the VB map due to reported communication deficits. So they might use that, or if there is kind of a client who's not really like gaining or like making changes in their like academic skills but would need help with their daily livings, a different skill might be, or different assessment might be a bit better for them. So this is the client onboarding template that I was talking about earlier. You guys should have grabbed that from the front, and this template provides examples and allows you to keep track and organize with the required materials needed for client onboarding. So you should have grabbed one of these. If not, please raise your hand and my assistant will go around and hand you one. So there's like a fill-in section where the referral details, the medical history, the family dynamics, previous interventions. So this helps you keep all of your information in one place. So this is a good resource for you guys to use. All right, and then goal setting. So this is a very important. This is, where things happen. When you are writing your goals, you want to make sure that you are making them socially significant goals based on the specific client. You want to make them individualized. And you're also going to make SMART goals. So what is a SMART goal? Okay. SMART. S is for specific, so they should be clear and well defined, easy for people to read and understand. You want them to be measurable. You should have a clear way to track your progress. For example, you may need to have at least 4 independent responses for every 5 responses. So that's like our example at the bottom. Client will man for preferred items using 1 approximation in 4 out of 5 opportunities across 3 consecutive sessions. I think I'm in the way of it a little bit. And then A would be achievable. You need to make sure that the goal is realistic and attainable for your clients. And then relevant. The goal should be socially significant and meaningful to the client's life. And then time bound. This means that there needs to be a specific timeline. In the example that I provided, they need to reach 80% for 3 consecutive sessions. So once those 3 consecutive sessions, if they reach 80 to 100% mastery, then they master that skill. And now we're going to practice. You guys should all have been given a handout with one of these 2 scenarios on it. Please break up into groups and work on a SMART goal for your hypothetical clients. We will meet back up in a few minutes to continue with this presentation. All right, welcome back, guys. Now we are on step 4. You guys did great with those SMART goals. I loved seeing you guys collaborate with each other. So step 4 would be, before services can begin, you will submit your treatment plan to the insurance company to be authorized before your client can begin services. So that's where the authorization process comes in. And then you also request for a certain number of hours as well during this time. Because and then the next step, it was the established service expectations, and this is where you go over with family the frequency and duration of sessions. So they're going to be there for 3 days a week, 3 hours long per day. Expectations for caregivers, how often that they're going to have parent meetings. Communication expectations, like how updates are shared, how to contact us when needed. And then the policy reminders, so our attendance policy, sick policy, just so the parents and caregivers and families are well aware of our policies and procedures and what is expected of them. Just to, be a collaborative approach. And then finally, we get to the exciting part. The client will then begin sessions. First sessions should start off with the therapist and the clients pairing together and building a relationship. You as a BCBA will then continue to monitor the progress and make adjustments to the treatment plan when needed. You will do a reassessment and a new progress report every 6 months to report on the progress. So exciting stuff. You guys got to the part where the client begins. And then thank you guys for listening and participating. Again, please make sure you have grabbed your resources if you have not already. So we have the client onboarding template and the checklist. You can access the client onboarding template to help you stay organized and complete all the onboarding steps efficiently. There's also my contact information on here, my phone number and email if you need to get a hold of me for any questions. Thank you guys.